Another group of sleep disorders are hypersomnia disorders. The most well-known of these is narcolepsy. Narcolepsy is relatively rare, occurring in about 50 per 100,000 people. People with narcolepsy have difficulty maintaining wakefulness during the day, but also have disrupted sleep at night. In narcolepsy type 1, the cells in the brain that produce the neurotransmitter orexin are selectively lost and orexin levels are very low or absent. One of the main things orexin does is stabilize wakefulness and manage states of sleep. Therefore, lack of orexin leads to unstable sleep-wake patterns. Also, patients with narcolepsy 1 often experience a symptom called cataplexy, which is an involuntary loss of muscle tone without altered consciousness and can be triggered by strong emotions. Narcolepsy type 2 is similar to narcolepsy type 1 in that patients suffer with maintaining wakefulness, but they do not experience cataplexy. Separate from narcolepsy, another central disorder of hypersomnolence is idiopathic hypersomnia, which is characterized by excessive daytime sleepiness and additional symptoms including prolonged, non-restorative sleep and severe sleep inertia. Narcolepsy and idiopathic hypersomnia are debilitating conditions if left untreated. Narcolepsy type 1 diagnostic criteria consists of periods of an irrepressible need to sleep or daytime lapses into drowsiness or sleep, plus cataplexy and/or low cerebrospinal fluid orexin levels. Additional criteria include a mean sleep latency less than or equal to 8 minutes on the multiple sleep latency test, and either 2 or more sleep onset REM periods on the multiple sleep latency test, or a sleep onset REM period within 15 minutes of a nocturnal polysomnography. Narcolepsy type 2 has no cataplexy and consists of periods of irrepressible need to sleep or daytime lapses into drowsiness or sleep for at least 3 months. Additionally, there will be 2 or more sleep onset REM periods on the multiple sleep latency test combined with nighttime polysomnography. Idiopathic hypersomnia also requires daily periods of an irrepressible need to sleep or daytime lapses into drowsiness or sleep for at least 3 months, and cataplexy is absent. At least one of the following must also occur. A mean sleep latency test is less than or equal to 8 minutes on the multiple sleep latency test, or total sleep time is more than or equal to 660 minutes in 24 hours. Lastly, polysomnography and multiple sleep latency tests findings may not be consistent with narcolepsy.